I mentioned this in a recent episode, but you know, I've got my Formula One book behind me, and I can flip back to the 1960s and 70s, and you see the crowds, and there's not one single obese person there, and presumably the rates of diabetes are really low. But it was striking to me just recently, you know, it was 9/11, and I went back and watched some of the documentaries of the footage of people running away from buildings and that tremendous tragedy. Even 24 years ago, man, like you saw some overweight people, but it wasn't like it is today.
Yeah.
And so I'm curious, with your career that spans that 35 years and includes, you know, what we witnessed at the Twin Towers 24 years ago,
Yeah.
how have you seen diabetes? Just like I'm assuming it's exploded in the last 35 years.
Oh yeah, it has. And again, a lot of it is because now we have more of a sedentary lifestyle, right? And you can blame some of the parents as the technology with these things has come in. All the kids now are on their phones, right? Or they're playing video games. They're not outside playing, climbing trees, riding their bikes, running around. I remember when I was a kid, again, on a Saturday, we'd leave the house at 6 a.m. on my bike, no cell phones, no pagers. We'd go out all day, come back before dinner. Parents had no idea where we were, right? Just trusted it. But we're out playing in sports and this and that. And so we're burning off like 10,000 calories a day. So again, we could get away with some bad food habits back then. But now, because our society is more sedentary with computers and technology, we're just not burning that off. And yet, the food, we're still eating a lot of food, a lot more fast food. And we can have a discussion, go down that rabbit hole about how the food is intentionally designed to keep us fat, with all the sugar and grains and everything else that's put in there, some of the artificial stuff. So that's what's happening. We're seeing type 2 diabetics, Casey, that are 12 years old, like 12 years
Crazy.
old, because their parents are feeding them Happy Meals 5 days a week. They're not exercising at all. And now that, I mean, it's asinine, but I
Yeah.
blame the parents for that because they're letting their kids get away with that. So yeah, we've seen it's skyrocketing. It's going nowhere but up. I mean, right now there's 38 million diabetics just in the US, 96 million pre-diabetics. It's insanity and it's going nowhere but worse. And there's nothing that I see anywhere that's really trying to solve this problem because there's so much money in it, but a program like ours that's saying, hey, look at, you can change this and fix it. So that's why it's really exciting when our patients join the program.
Yeah, that's amazing. Do you recall as you were, you know, out playing, if you ended up at the house at like 2 in the afternoon, your parents would like yell at you to get back out there. Like, what are you doing home?
Exactly.
Get out of here.
Oh yeah,
Totally
back
opposite
then,
now.
I mean, I turned 61 a couple months ago. So back then there was only three channels, ABC, NBC, CBS, so we watched TV maybe like one little show at night after dinner, but no, no, we weren't inside watching TV. There's no video games back then. I mean, your
Right.
your video game was outside playing. That
Exactly.
was fantastic. And I don't see that anymore. You drive around neighborhoods like, where's the kids? Like you don't see anybody. They're all inside on their phones and it's just, oh,
Yeah,
it's
I
really
know. It's
crazy.
terrible. Even back then, like with the three channels, you had to physically get up and like turn the dial. I remember having to
Exactly.
do that. At least got some
Exactly.
exercise
Yeah.
there.
I was remote control. It's like, Jeff, go change the channel.
Exactly. Okay, so let's talk about the disease process. You mentioned diabetes, you mentioned pre-diabetes. How is it that somebody, like you said earlier, can be pre-diabetic for so long without manifesting diabetes? Like, can you explain like what's going on that eventually leads to a diagnosis of type 2 diabetes?
Yeah. So again, you'll see the pre-diabetics, again, typically in the younger people. And there are some that they can stay pre-diabetic into their 70s because even though they're eating bad enough things to have, elevated A1C a little bit, they're not eating so bad where it kicks them over the edge where they get the diagnosis, right? So that's kind of where the fine line is, right? The A1C, if it's between pretty much 5.7 to 6.4, that's the pre-diabetes range. 6.5 or higher is diabetic. So yeah, a little bit of gray area. They're fudging on those numbers. But one thing I will tell you, Casey, I don't know if you know this, but when I got out of school 35 years ago, normal blood sugar was between 80 and 120. That was normal. And then magically, 9 years later, all of a sudden, normal became between 70 and 99. So now anybody who was normal between 100 and 120 was now abnormal, which now required, wait for it, medications, right? So they basically fudged the numbers. Same thing happened with cholesterol. When I would get out of school, normal cholesterol was 250 or under. And then again, about 9 years later, all of a sudden now cholesterol, they want it under 200. So again, anyone between 200 250 that was normal now needs a statin medication. So these are the kind of crazy things that happens. And so a lot of the fudging of the number. So that's why we say if we can get an A1C to be 5.9 or lower and you're taking no diabetic meds, you are good to go. So that's kind of our main barometer where we want to get people to. Doesn't have to get down to 5 or anything else. If it's 5.9, no meds, you're good to go. But yeah, so long answer to your question about that. There are people that can stay pre-diabetic for quite a while and just never get to that full diagnosis.
Yeah,
See
and it's
that a lot.
interesting. I like that approach. It's interesting because you do hear the stories of people that are taking their A1Cs down at 5 or below 5, but
Yeah.
it's also those are people that are being extremely strict on very restrictive diets. Not everybody can do that. Like you say that in, my space of ketogenic diets. Like people can get their A1C down really low, but there's also it's really difficult to be able to do that. And just learning
Yes.
that, from some people even in my space saying like, if we can get this down even a little bit, like you said, like below 5.8, 5.9, that's a
Yeah.
big step. That's a good step in the right direction. Is that perfect? No, but you're at least not causing crazy amounts of damage or,
Exactly.
things leading to like amputations or whatever. Is that kind of what you're noticing?
Yeah, exactly. Yeah. And again, so 5.9 or lower, it's again, you're good to go. And that's the funny thing with blood sugar too, is a lot of people they want to get it below 5, where now your blood sugar's down into that 80 range, and that might not be optimal for somebody. Somebody might function better at a 95 blood sugar or 105. So arbitrarily wanting to push it down, I got to get it below 5. No, you don't. Like, just how do you feel? How's your energy? So that's why there's a scale, right? Even with blood pressure, there's a scale with it. Doesn't, you don't want to have your blood pressure be like 80 over 40. There's a range. And so that's kind of, I want to make sure people focus. That optimum functional range that your body's really good at instead of sometimes these arbitrary numbers on the lab. So
Yeah. Yeah, you mentioned blood pressure. That's another scale that's kind of dropping in that same way, right? It seems to
yeah,
be lower and lower as the years go on, so they can maybe prescribe like a hypertensive medication when you're right,
yeah.
like somebody slightly higher might be just fine.
Yeah, exactly. Haven't seen that as dramatic as the blood sugar
Got
and
it.
the cholesterol, but yeah, same thing. It's happening. Because again, your blood pressure, a lot of people are, they feel lightheaded and they're weak because now they're taking a blood pressure med and their blood pressure getting pushed artificially too low. It's like,
Too
dude,
low.
you're taking too many medications. What are you doing? You
Yeah,
know? But
good
again, it's
point.
hard to get a doctor once they put you on the med to want to take you off the med. They feel like that's the crutch that, and we'll see that a lot with our doctors, with our patients, where the blood sugar gets down, A1C gets down to like 5.7. They're taking maybe a little bit of metformin and they're hesitant to get them off that last little bit or that last 5 units of insulin, like, so it's okay. But yeah, it's hard to get them convinced. So
Okay. The numbers that we mentioned are really like blood sugar related. So we mentioned a
yeah,
fasting blood glucose. Hopefully, people are fasting when they're taking their blood glucose to give them a good range.
yeah,
You mentioned A1C, which can serve as like an average, 3 to 4 month glycation period, depending on a few circumstances. There's a few assumptions baked in there, but do
yeah.
you think? Do you think those metrics are the wrong metrics? Like you hear people saying that really we should be looking at fasting insulin levels versus the glucose levels, as the insulin can be rising for a long time before we ever see the elevation of blood sugar numbers. Do you think we're measuring looking at the wrong metrics when we are
My
diagnosing?
experience, in my experience, Casey, the A1C is the gold standard. So, because that is like a 3 month average of your blood sugar. And so, if your A1C is 5.9 or lower, that means for an average of 3 months, your blood sugar has been pretty good. So, to have to go, oh, let's see what the insulin is doing, everything else, I think it gets too complicated and they try and make something more complicated than it really is. Not to say that there can't be something rising, but again, if that insulin's rising, then there's going to be issues showing up on the A1C. So we'd like to make things real simple, right? Just get it to 5.9 or lower, no meds, you're good to go, and keep it at that level, maintain that the rest of your life. You're not going to see the complications from diabetes.
Got it. When we talk about the metabolic component of type 2 diabetes, you mentioned, the food being a primary thing. You mentioned a lot of the sugar, processed food, possibly food dyes or other additives. Are those, I mean, that's got to be the main culprits, right?
Yeah, well, it's definitely the food is the biggest thing, right? Is obviously a lot of the grains. So it's the breads, the pasta, the rice, the pizza, crackers, all that stuff. So on our program, all those things got to go, right? Because that's going to spike the blood sugar big time. It can cause celiac disease, on and on, right? Another big culprit is dairy products, because dairy products have lactose in it, which is a sugar, and that can spike the blood sugar. It's bad for cholesterol, bad for the heart, etc. So those are the kind of the two biggest ones categories that people need to get off of on our program. And then I can go into caffeine, which spikes the blood sugar because it causes a cortisol reaction, right? A lot of people don't not aware that, oh, if caffeine's totally fine. No, it's not. It's like it raises blood sugar, raises blood pressure, so all the benefits of caffeine, in my experience, are outweighed by the negatives. But you can type in, is caffeine good for diabetics? You'll see half the research say it's good, half the research say it's bad, So again, that's when you got to go back to physiology, right? Caffeine's a stimulant, stimulates the adrenal glands, produces more cortisol. Cortisol raises blood sugar. Period. That's it. Just like you take caffeine, it raises your blood pressure. So if you're on blood pressure pills, you should not be taking caffeine. So those are things again, but doctors don't teach their patients that. So yeah, those are the biggest things. Now, of course, stress can cause increase in blood sugar as well. A lot of times over exercising, like exercising too intense for your body, as you know, can cause a cortisol reaction, raise blood sugar. So we have a lot of our patients, we got to have them tone down the intensity of the exercise because that's one of the things that's keeping their blood sugar elevated. Like I exercise 2 hours a day, 5 days a week, and my blood sugar is not coming down. Like, well, you're doing too strenuous for you. Not to mean stop exercising, but it doesn't mean not to be so crazy. And those are some of the things that we look at, but it's definitely not just one thing for sure, Casey.